A transient ischemic attack, TIA, often dismissed as a temporary episode, may in fact be a silent but devastating threat to brain health. While many people believe that a mini stroke leaves no lasting damage, new research reveals a far more troubling reality, one that could contribute to the alarming rise in dementia cases. Scientists now warn that even short-lived disruptions in blood flow to the brain can set off a chain reaction of cognitive decline, increasing the risk of severe neurological disorders in the years that follow. The latest findings from the University of Alabama highlight that a TIA is not just a warning sign of future strokes, but an independent risk factor for dementia. This means that many people who experience these brief attacks may be unknowingly accelerating their own mental deterioration. The consequences of underestimating a mini stroke can be severe. Up to 20% of individuals who suffer a TIA go on to develop dementia, making it a significant driver of cognitive decline. Yet, because symptoms often resolve within minutes, many people ignore them and fail to seek medical attention. This missed opportunity for early intervention is particularly dangerous, as timely treatment with blood thinners, cholesterol-lowering drugs, or blood pressure medications could drastically reduce the likelihood of both stroke and cognitive impairment. However, the lack of awareness surrounding TIAs means that far too many cases go undiagnosed, leaving people vulnerable to progressive brain damage. The risk of dementia following a mini stroke is not a rare occurrence, but a pattern confirmed by multiple studies. A long-term analysis comparing over 350 TIA patients with nearly 15,000 healthy individuals found that those who had suffered even a single mini stroke faced significantly higher rates of cognitive decline. Despite some limitations, experts stress that these findings cannot be ignored. The correlation between vascular incidence and neurodegeneration is well documented, and the emerging data only reinforce the urgent need for better education and prevention strategies. Yet, despite these warnings, the medical community continues to struggle with widespread misinformation and inaction. Many people still believe that because TIA symptoms disappear quickly, no real harm has been done. This dangerous misconception leads to unnecessary suffering, as the damage to the brain can be subtle but cumulative. Each TIA weakens the brain's resilience, increasing the risk of future strokes and accelerating the onset of dementia. Ignoring these warning signs is essentially allowing an invisible but relentless assault on cognitive function to continue unchecked. Medical experts now call for a shift in public perception and policy. Greater awareness campaigns are needed to ensure that people recognize the urgency of seeking medical care after a suspected mini stroke. More proactive screening measures should be implemented, especially for those at high risk, such as individuals with hypertension, diabetes, or a history of heart disease. Additionally, healthcare systems must make stroke prevention a higher priority by integrating routine vascular assessments into standard medical checkups. Without these efforts, TIAs will remain an underestimated yet deadly contributor to the global dementia crisis. The message from researchers is clear: a mini stroke is not a minor event. It is a critical warning sign that demands immediate action. The potential for lasting cognitive harm is far too great to ignore. Recognizing the symptoms, sudden confusion, vision loss, difficulty speaking, dizziness, or temporary paralysis, and treating them as a medical emergency could mean the difference between a healthy future and irreversible neurological decline. For those who experience these brief but dangerous episodes, acting swiftly may be the only way to protect their minds from a fate that could have been prevented.